Good afternoon, everyone. Welcome to the Senior Hunger Initiative. My name is Timmy Tope Walker. Just go by Tope for short. Some call me Dr. Walker, just a nod to the work that I put in for my PhD. So just want to clarify that is not a medical doctor, so I cannot treat you, but I will certainly listen to how you've gained the COVID-20. So with that being said, I am the Senior Hunger Nutrition Coordinator within the Division of Aging Services in the Department of Human Services. And I'm doing my due diligence to share that our mission is always stronger families for a stronger Georgia. And think of this as a syllabus. I was told I have 30 minutes, but if not, I can make it shorter. So this is my question and out loud talking here. But I always like to put the pronunciation of my name because it gets destroyed by the end of a presentation, but I do leave time for questions if you're not familiar. But we'll be talking about what some key terms are for senior hunger because I always want everybody to be on the same page about this. What are the current statistics as it relates to seniors and senior hunger in Georgia? What is the senior hunger plan, the 5 focus areas and the recommendations that are part of that? What my particular role is as a senior hunger nutrition coordinator, and then current progress in addressing senior hunger in the state of Georgia. Of course, as you can see from my background, if you can see me, I'm advertising for the 2021 Senior Hunger Summit, of which we are preparing for the 5th. And then, of course, questions at the end. And of course, if you have them in between, but I look forward to seeing what those are as they come in the chat. So key terms that I would love for everyone to know and understand. So when we talk about the term hunger, that's specifically talking about a physiological condition. So by not being able to eat, the result of the term food insecurity, which I'll talk about specifically because sometimes these two terms get interchanged. It's very important that we understand distinctly what we're talking about. So hunger, we're talking about the fact of not eating at all. And so your stomach is empty, all of that. So that is the far end that we're definitely trying to keep seniors from getting to. When we talk about malnutrition, that term comes up as well. In the most basic sense, that is referencing an insufficient intake of nutrients. So whether you are dealing with obesity or malnourishment in the sense you're most familiar, where you have nothing to eat and so you literally have no nutrients coming in, besides the fact that it may not be appropriate of the right types. That's the spectrum when we talk about malnutrition. So the term that always gets synonymously mixed with hunger is food insecurity. When you hear that term, so this is a very basic one of many, but what you want to think about is really it's the financial inability to purchase food in an adequate manner. So we're talking about not necessarily that you don't prefer one thing or another, or that you only eat certain things, or that you would prefer to have steak and you got chicken and all of that. We're really talking about the fact that you don't have the means to purchase food, and therefore you make decisions such as skipping a meal, cutting it in half, not eating at all. So those type of decisions, all because financially you're not able to do so. And then in what you're able to get, when we say adequate, we're talking about like you could have access to salmon, but if it's in a trash can, you're homeless, and just being able to pick it out there. Yes, salmon is great, but certainly not the socially acceptable way in which we would expect meals to come. So those are the things you should be thinking about. The one that also comes out when we're talking about hunger are food deserts. And that classification, I want to just clarify, we're really talking about the existence of a supermarket or a large grocery store. Now, one could argue about the quality of the produce that's in there and all of those things, but we're really talking about those particular structures and their distance from where people live. So usually when we're talking about an urban setting, that could be more than a mile of distance getting to a supermarket or a large grocery store. In rural settings, that distance is greater, so more than 10 miles to actually get to a supermarket or a large grocery store. So now that you're schooled on the terms of hunger that generally come up, let's get into the numbers. So one of the things I like to just share and really have us understand that though we're in the Division of Aging Services, the numbers by which we are held accountable are even numbers that we don't reach for a number of reasons. We are limited by staff, capacity, dollars, all of that. And so that really makes us understand how important it is for us to work in partnership with others, because there's so many seniors that are in need, and we cannot serve them all. And so what we know, so 2018 is a number that comes up a lot on this slide, and that's because that is the latest numbers. So of course, literally hot off the presses just yesterday, we heard some tidbits about census information, and I think the rest of it's coming. I think I heard either August or September will be the rest of it, but that's really where we're starting to see we'll get more information about what the numbers tell us where our seniors are. But we know that in the state of Georgia, there's nearly 2 million older adults, 60 plus. And in that number of seniors, about 11% of those are living in poverty. And so all of that to say, we've just focused on the term food insecurity. So when we say marginally food insecure, meaning that for the scale that we measure, so the Division of Aging Services measures food insecurity, that is responding yes to one of 6 questions. So that could be saying that I skip meals, I cut my meals in half, all of those type of responses. A person is saying yes to one of those. And that 16% by the math puts us at about 300,000 seniors who are at risk of hunger, meaning that they've started the trajectory of which they're making some decisions in which they're not eating all the meals that they could eat for some financial means, for some financial reasons. And one of the huge safeguards, and even in this moment, well, if you're not familiar with the current legislation that's come out, the federal government has maximized the amount of SNAP benefits that are offered to individuals and their households. And so if a person who would normally get $16, which is the current minimum, everyone's getting the max. And I think they raised that by 15%. So that could be anywhere from $204 to $215 for a household of one. And so you can see how important it is to have this safety net, even in this moment, to be able to purchase food. What we know is that those who are living in poverty, about 77% of those are on SNAP. So there is a gap there, but it is actually promising to have that number of people who are living in poverty at least have access to SNAP benefits who are 60 and older. Some critical ones, when you think about senior hunger, people always ask me about meals. So CM, congregate meals, HDM, home delivered meals. So this is where I will talk about specifically what my role is in the bigger picture, because we do have a chief nutritionist and her role is distinctly different from mine. But when we talk about hunger, meals is the thing that comes up. So it is important to kind of recognize that critical part, the provision of meals for older adults. So in the last state fiscal year 4 million meals were provided collectively between congregate and home delivered meals. And a huge support for the work in being that first level of contact for seniors, their family members who are reaching out to try to provide assistance is the Aging and Disability Resource Connection. And so I pull that number up because it's important for us to understand that before we get to saying, okay, I need a meal, I need other things, one of the reasons that we financially get to this point is that other services are needed and those become taxing, whether it's medical cost, housing costs, all of that. And ADRC is a great resource to open that door for people to get those benefits and services that they need to hopefully not get to the point where hunger is an issue because they're getting those other needs met. And then the other part is I talked about the percentage of older adults who are on SNAP who are living in poverty. One of the great things about the state of Georgia was to put this in mind, because it's not just about, you know, the context of senior hunger, but you may know of a person in your work, whether you are doing direct service or not, of which understanding that in the state of Georgia, we have a senior SNAP program, and that provides a simplified application for seniors. And so if you recognize that there's 300,000 seniors who are at risk of hunger, and that DAS maybe serves about 30,000 clients, that gap is huge, but there are services that can help to fill the need. So there's 135,000, just over 135,000 seniors who are participating in the senior SNAP program. So they're getting those benefits now. So that opens the door for a lot more partnerships, but wanted you to understand the backstory of what we're working with. So my guiding document for the work that I do is Georgia State Plan to Address Senior Hunger. Of course, it's online. This is probably the hardest email to try to think about, but usually if you Google Senior Hunger State Plan, it pops right up. But I'd like to just reference this, that it's though I do have some ability to be creative and think about addressing senior hunger, this is the document that really started it all. And so that was published in December of 2017. And I started here in July of 2018. So the state plan has 5 focus areas. They are today's seniors. So basically the recognition that how seniors are, whether they're young, old to old, they are very different in what they're able to do, and the dynamics of that household, whether they're a grandparent raising grandchildren, they live alone, they're living with their own kids. So all of those dynamics play into what their needs are. And then a model, we say Monday through Friday because for the Division of Aging Services, a lot of our service delivery occurs through our senior centers. And of course, even in this moment, we recognize how important it is for us to be more open to other forms of service delivery, because in this moment, a lot of the senior centers are still closed. So this model of Monday through Friday, or having seniors come to the senior center, we really have to be open to, you know, what some other possibilities are. Aside from that, meeting the needs of the community. So there are a lot of services that are available that we're still learning about as a state. And so this really opens the door for us to be talking about partnerships, whether it's through faith-based entities, building school partnerships, recognizing grandparents raising grandchildren. If you address the needs of the children, you indirectly help the seniors, or even in the sense of partnerships, recognizing that universities and colleges do research, and we should support the work and being able to highlight how we can improve senior hunger by saying, okay, what research opportunities are there to really spotlight the concerns and really move us forward in understanding what we can do. Okay, so then we have food access. Food access covers from transportation, getting food to seniors and seniors to food, reducing food deserts, there's that term again, and then SNAP participation, that's a huge one. How can we so if we look at overall, what we know is about 42% of seniors who are eligible for food stamps actually apply for the program. And so that leaves a huge gap for an opportunity to get more seniors on and be that support. So we're really advocating for that. Food waste and reclamation gets into really understanding more about, you know, what are the policies on being able to take food that's already been cooked and warmed and ready and transfer to someone else to be able to give those out, building those connections between agencies that collect food and give it to others. And what does that mean locally, whether it's at the senior center or even in someone's home, and being able to compost and all of that. How do we pull those resources together? And then the health impact of senior hunger. We recognize that persons who are diabetics, who have cardiovascular disease, have very specific diet needs. And so those foods can be costly. It's cheaper to get things that are fried or with a high salt content, high fat content. And so that could be a financial barrier to be able to do that. And if you're not eating right, you can make your health conditions worse. We recognize that's an area that we need to work on as well. So aside from the focus areas in the state plan, there are recommendations. And here they are. So the first is to establish a DHS staff senior hunger position. So they checked that off with the hiring of myself. So they were off to the races in July of 2018. And then the next was to develop regional coalitions. So if you look at the beautiful graph on this page here of Georgia, there are 12 area agencies on aging, which I'm sure in your orientations you are now familiar, but there are senior hunger regional coalitions that map in each of those areas. And so we get to see the work that's progressing there. The three recommendations in the middle are in progress. So the Policy Review Council is really an attempt to reach out to other state agencies with the recognition that we should break down the silos that prevent us from working together and really understanding how these services should be shared with our seniors, and we too should know what's going on so that we can better coordinate resources and efforts. For example, DAS and DFACS are both within the Department of Human Services, but we have different systems that we work out of. We have different federal arms for which we are guided, but we have a similar mission. And so we should be able to work together and see how we can serve our overlapping clients. Coordinating data collection analysis. This also is the same, where we're trying to understand more about our clients to say, if we're going to look at food insecurity among our clients, we need to understand that, okay, yes, the provision of a meal that which we provide specifically may not be the only supports that a person needs. They may need SNAP. They may need nutrition counseling. They may need other services, and that would free up money for them to be able to purchase food. So there's a lot of other factors involved there. Providing education and training. We want people to know, just in this moment of you doing this orientation, to understand more about senior hunger, about the SNAP program, all of those things that we can help to address senior hunger and make sure that we're all on the same page. And we're fully done with continuing and expanding the What a Waste program. We started with 9 sites of the nearly 200 senior centers that exist. We went all the way to 36 sites, going through the What a Waste program, which was essentially providing training for senior centers to know how to reduce the amount of food waste. And that included things like making sure, or opening up the opportunity for the seniors to select their meals ahead, to see what was being wasted and try to, rethink the types of meals that are provided to meet nutrition requirements and still make sure they get eaten. Because you can check off, okay, good, they've provided these nutrients, but if they end up in the trash, they've not eaten them. Okay. And so then providing entrepreneurial mini grants. We've been very fortunate that our commissioner for the Department of Human Services has been able to designate funds for the coalitions that exist for them to then designate those to support senior hunger initiatives in the 12 regions. So that's been really critical for us in expanding the impact of the work, but that's not the whole story. The state can't fund all of the initiatives to address senior hunger. So part of that too is also continuing to find funding and share that with the coalitions and all of those who are interested in supporting the work to address senior hunger. So that is part of that. Okay, so my particular role. So of course I coordinate the implementation of Georgia State Plan to address senior hunger. I also plan the annual Senior Hunger Summit. I will tag that more shortly. Assisting in development of the coalition membership. So I noted there were 12 across the state. So I try to attend those meetings before I had to actually physically go across the state, but in this virtual space, I am logging into Teams and Zoom and everything in between to attend those meetings and just provide a state support and perspective on what's happening to address senior hunger. If there's any technical support that's needed for the coalitions and their membership, I make myself available. We develop and conduct the annual meeting to meet with those coalitions at the Senior Hunger Summit, and we've also expanded for opportunities to have meetings on top of that. And of course, we monitor the work that's happening to identify the gaps and resources and opportunities with an annual report that we get from the coalitions. And that feeds into a newsletter that we just started this year. And as I promised, I wanted to plug the 2021 Senior Hunger Summit. We have experts, policymakers, community stakeholders, all people who are interested in knowing more about senior hunger, finding solutions, sharing solutions, and it is scheduled for Tuesday, June 15th. It's being held virtually. It is absolutely free, and any of you who are in attendance today can absolutely attend. If you've not seen the email, to do so. I welcome the opportunity to share that with you. You can register. I think right now we're just over 300 people who are registered for the conference so far. So we will be talking about all the wonderful initiatives that have occurred even in this moment, and just looking ahead about, how COVID has impacted everything and where should we move next as we prepare for the next state plan to address senior hunger, which is part of the work that's coming in this next state fiscal year. So I think I managed to keep in my time here. Are there any questions about senior hunger?
You can raise your hand. We have a few minutes.
While people are pondering, let me.
Erica Jones has a question.
Okay. Yes.
It's a comment and a question.
Okay, sure.
Just thinking about some of the common themes when you were talking about the Monday through Friday model.
Yes.
And the agency that I just joined, Sawega Counseling with Aging,
Okay.
are using a model of senior center without walls.
Yes. Mm-hmm.
Which I think kind of plays into that theme that you're talking about, going beyond that Monday through Friday. How can we possibly in the future contribute to like maybe data collection that can I guess support that idea of growing those other agencies to do that type of work so that they can reach that population? So there is a question in there, I guess.
Okay, fair enough. I'm certainly excited about this. Renee Brown, who's our chief nutritionist, is following this very closely. And so one of the things I'm excited about is, like you said, the data that's there. We rely heavily on each of the area agencies on aging inputting their data into the WellSky system, with the hopes that as we look to this and say, okay, is this a model that is expandable? What are the lessons learned and things like that? We can do that type of assessment. One of the plans for the Senior Hunger Initiative in general is to have a toolkit to kind of talk about what are some best practices and some engagement opportunities, whether it is Senior Centers Without Walls, as a model that shows what can happen when we expand our thinking. And so things like that is what we're looking to include. So I'm definitely excited about the opportunity with that. And so I think right now I don't know exactly what we're collecting besides saying, okay, we know, one of the things that I've been excited about is in this moment, what does that mean for the meals? I know a lot of partnerships with restaurants and things have occurred. And I'm excited to see what does that mean for increasing in membership. And I've heard, Sawega's has way more participation with that model than they've had before. So their phones are ringing off the hook. So I always welcome the opportunity to hear more about their work, and actually had Izzy to present at our Senior Hunger series that we had in October. And we will actually have all of the coalition coordinators, which of course includes Sawega, to share their work. And I don't know if that may be part of that as at the Senior Hunger Summit. So I'm excited to hear the progress of that.
Thank you.
Mm-hmm. Thank you for the question.
Anyone else?
Well, I guess in the space, I do want to say that one of the reasons why I put this information out the way that I do is um, a lot of the information, we're treading new territory. We're the first state to have a senior hunger plan. Um, we are open to learning what the awesome things that are happening in 159 counties that we have in the state of Georgia. I don't know everything. I don't know everyone. You guys are all coming from very diverse backgrounds, whether it's personal, work related, all of that. And so I always welcome the opportunity to hear what you heard, what you know, sending emails from all walks, because that's how we've gotten people that we ultimately invite to come to the summits. That partnerships are built, and it's just people knowing, okay, this is what is the space that we're in here. Let me share this information. And if you ever have any information to share like that, I'm always listening, because that's how opportunities and doors are opened. So thank you.